Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on dermatology common rashes, each with 4 answer choices and detailed explanations. Dermatology clinical vignettes. 1. Atopic dermatitis, eczema. A 3-year-old boy is brought in for a pruritic rash on his cheeks, flexural surfaces, and trunk. His mother reports a history of asthma and allergic rhinitis. Examination shows erythematous plaques with lichenification and excoriations. What is the most likely diagnosis? A. Atopic dermatitis, B. Contact dermatitis, C. Psoriasis, Tinea corporis. Answer: A. Atopic dermatitis. Explanation: Atopic dermatitis is a chronic pruritic skin condition associated with the atopic triad, asthma, allergic rhinitis, and eczema. It typically affects flexural surfaces in children and adults. 2. Contact dermatitis. A 35-year-old woman presents with an itchy red and vesicular rash on her wrists after wearing a new bracelet. What is the most likely diagnosis? A. Atopic dermatitis, B. Psoriasis, C. Contact dermatitis, D. Tinea corporis. Answer: C. Contact dermatitis. Explanation: Allergic contact dermatitis is a delayed type 4 hypersensitivity reaction. Common triggers include nickel, poison ivy, and latex. NASH 3. Psoriasis. A 40-year-old man presents with well-demarcated erythematous plaques with silvery scales on his elbows and knees. There is also nail pitting. What is the most likely diagnosis? A. Seborrheic dermatitis, B. Psoriasis, C. Atopic dermatitis, D. Psoriasis rosea. Answer: B. Psoriasis. Explanation: Psoriasis is a chronic inflammatory skin disease with hyperproliferation of keratinocytes. Classic findings include scaly plaques on extensor surfaces and nail pitting. Seborrheic dermatitis. A 55-year-old man with Parkinson's disease presents with a scaly, greasy rash affecting his scalp, eyebrows, and labial folds. What is the most likely diagnosis? A. Psoriasis, B. Seborrheic dermatitis, C. Tinea capitis, D. Rosacea. Answer: B. Seborrheic dermatitis. Explanation: Seborrheic dermatitis is caused by Malassezia yeast overgrowth and is common in patients with Parkinson's disease and HIV. 5. Psoriasis rosea. A 22-year-old woman develops a single oval, scaly herald patch, followed by a Christmas tree pattern rash on her trunk. What is the most likely diagnosis? A. Psoriasis, B. Psoriasis rosea, C. Tinea corporis, D. Scarlet fever. Answer: B. Psoriasis rosea. Explanation: Psoriasis rosea starts with a herald patch and progresses to a diffuse salmon-colored rash in a Christmas tree pattern. #6. Tinea corporis, ringworm. A 10-year-old boy presents with an itchy, circular, scaly rash with central clearing on his forearm. What is the best initial treatment? A. Oral griseofulvin, B. Topical corticosteroids, C. Topical terbinafine, D. Oral prednisone. Answer: C. Topical terbinafine. Explanation: Tinea corporis ringworm is a superficial fungal infection that presents as an annular, scaly lesion with central clearing. #7. Scabies. A 28-year-old woman complains of severe itching that worsens at night. Examination shows linear burrows in the finger webs and wrists. What is the best treatment? A. Oral terbinafine, B. Permethrin 5% cream, C. Antihistamines, D. Topical corticosteroids. Answer: B. Permethrin 5% cream. Explanation: Scabies is caused by Sarcoptes scabiei mites and presents with intense nocturnal pruritus. Treatment is topical permethrin or oral ivermectin. #8. Acne vulgaris. A 17-year-old boy has comedones, pustules, and papules on his face and upper back. What is the best initial treatment? A. Topical benzoyl peroxide, B. Oral isotretinoin, C. Oral prednisone, D. Antifungal cream. Answer: A. Topical benzoyl peroxide. Explanation: Acne vulgaris is caused by follicular hyperkeratinization, excess sebum, and Cutibacterium acnes. Benzoyl peroxide is first line. 9. Erythema multiforme. A 25-year-old man presents with target lesions on his hands and feet after a recent herpes simplex virus infection. What is the most likely diagnosis? A. Erythema multiforme, B. Stevens-Johnson syndrome, C. Toxic epidermal necrolysis, D. Urticaria. Answer: A. Erythema multiforme. Explanation: Erythema multiforme is a self-limited immune response often triggered by HSV causing target-like lesions. 10. Stevens-Johnson syndrome, SJS. A 40-year-old woman develops painful mucosal erosions, fever, and widespread bullae after starting lamotrigine. What is the most likely diagnosis? A. Erythema multiforme. B. Stevens-Johnson syndrome. C. Toxic shock syndrome. D. Bullous pemphigoid. Answer: B. Stevens-Johnson syndrome. Explanation: SJS-10 are life-threatening hypersensitivity reactions, often triggered by drugs, e.g. sulfa drugs, anticonvulsants. Final